Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Signs, symptoms and uses of ammonium carbonicum. Full name ammonium carbonicum, short name Ammon Carb. I will use this name henceforth for convenience. Common name smelling salt. Source chemical compound, chemical kingdom. On the right hand side, top, the crude ammonium carbonate salt or compound is image is shown, and below the medicine. Therapeutic uses of Ammon Carb: asthma, bronchitis, cough, epistaxis, emphysema, hemorrhage, headache, heart affection, leukorrhea, menstrual disorder, nose affection, tonsillitis, and others. Spheres of action of Ammon Carb: it acts upon cardiovascular system, respiratory and gastrointestinal tract, nerves, bones, female genital organs, etc. Diathesis of Ammon Carb: hemorrhagic. Is Ammon Carb hot or chilly? Very chilly. Mental journals of Ammon Carb: out of humor, forgetful, gloomy during wet, stormy weather, mentally active but soon gets exhausted, heedless and unruly, depressed with weakness of intellect, vacant mind, loss of memory worse from vexation, disposed to weep, tendency to make mistakes in speaking, writing and calculating. Physical journals of Ammon Carb: adapted to fat persons with weak heart, wheezing respiration and suffocative feeling, to stout women who are always tired, weary, take cold easily and suffer from cholera-like symptom before menses and lead a sedentary life. Great sensitivity to cold air, great aversion to water, heaviness in all organs, uncleanliness in bodily habits. Discharges are hot, acrid, adherent. Hemorrhage dark, thin. System prone to catch malignancy. Easy prostration, lies down from debility or soreness of whole body. Ill effect from charcoal fume. Look here, this is fat persons, looking fat, but actually they have weak heart, there are troubles in lung, etc. And this is a typical image of lady with sedentary habits. General aggravation and amelioration of Ammon Carb: worse, cold, cloudy days, damp cold, cold open air, falling asleep, 3 to 4 am, during menses, motion, chewing, pressing teeth, bending down, new moon. Better from pressure, eating, lying on abdomen, dry weather, lying on right side. Head symptoms of Ammon Carb: violent headache, full bursting in forehead, brain seem loose, shocks passing through head, eyes, ears, nose on biting. That is, when the patient bites, he feels that shock passing through these organs. Eye symptoms of Ammon Carb: asthenopia from prolonged use of eyes. Asthenopia means when the eye is tired for tremendous usage, or some power problem, spectacle power problem. In this way, the eye is exhausted. Asthenopia. Eyes burn and dry, appearance of yellow spot on looking at white object, flood of tears, large black spots float after showing, pain in eyes better after afternoon nap. The headache, bursting headache of forehead, and this is the particular gentleman is trying to get relieved of asthenopia for long use of screen. Yes, symptoms of Ammon Carb: hard swelling of parotid and cervical glands, hardness of hearing, itching above the ear spreads all over the body. Parotid, parotid gland, this is parotid glands is one of the three sets of salivary glands. This parotid is the biggest salivary gland, just lying beneath our ear. This helps in our digestion rather. Cervical glands. This is cervical glands. Cervical glands lies in series in the neck region. These are actually the glands of it's called lymphatic gland or lymph glands. If these lymph glands are enlarged, this is of very much consequences, because the patient who have got tubercular background, scrofulous nature, most of their cervical glands are enlarged. But this enlargement of parotid gland is rather and light matter. It's from some bacterial infection. It happens and it goes off easily. But this is of serious consequence. This cervical gland. Nose symptoms of Carb: snuffles of children, nose bleeds after waking, washing hands and face or eating, constant urge to sneeze, profuse watery coryza, blockage of nose at night. With continuing coryza, must breathe through mouth, boil on tip of the nose. Face symptoms of Carb: corners of mouth sore, cracked and burn, cracks and burning in lips, boils and pustules on the face during menses, hard swelling on the cheek. Mouth symptoms of Carb: toothache during menses, vesicles on tongue burn, preventing eating and speaking, mouth and throat dry, pressing gums together sends a shock through head, eyes, ears and nose, gums tender and bleeding. Throat symptoms of Carb: enlarged tonsils and glands of the neck, gangrenous ulcer on tonsils. This is the gangrenous ulcer. This tonsil has been turned to gangrene, that is simply totally destruction of tissue will be there, gangrene, from gangrene. Diphtheria when nose is stopped and membrane extend to upper lip. Now membrane, what is membrane? Diphtheria is clinically understood by this white type of membrane, those generally starts from lower portion of throat, that is larynx, pharynx, and it generally comes upward. This is a portion of membrane. This membrane, in case of Carb, extend up to upper lip. That is, here is the upper lip up to this level. Stomach symptoms of Carb: flatulent dyspepsia, appetite satisfied by little food, pain at the pit of stomach, with heartburn, nausea, waterbrush, and chilliness. Now, what is pit of stomach? This is the pit of the stomach. Just beneath the sternum bone, there is a depression. There is a depression that is called pit of the stomach. Abdomen symptoms of Carb: dark, acrid diarrhea, colic with pain between the scapulae, constipation, bleeding piles, worse during menses, discharge of blood before and after stool, protruding piles, worse after stool, better lying down, cannot walk. Urinary symptoms of Carb: involuntary urination towards morning, frequent desire to pass urine, urine white, bloody, sandy, turbid, faded and copious. Male genital symptoms of Carb: persistent erection without desire or violent sexual desire without erection. Look at the trouble. Persistent erection, there is no desire. Sexual desire, violent, there is no erection. After a question, frequent seminal emissions. Female genital symptoms of Carb: cholera-like symptoms with menses. Menses too early, too frequent, blood clotted, black with colicky pain, with hard, difficult stool, and too much weariness of thighs, yawning and chilliness. Menses flow more at night with dyspnea or weakness, copious leukorrhea, burning, acrid, watery, irritation of clitoris. Respiratory symptoms of Ammon carb. Increasing difficulty and oppression in breathing. Trouble wakes him up. Better in cool air, worse in warm room. Emphysema. 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 Uh, I have just placed here an X-ray photograph of emphysema. See, this is the X-ray photograph. Emphysema, in emphysema, both the lung look dark black, almost dark black, because there is too much air in the lung space. What happens actually, the alveoli are lost their elasticity, so air comes in but cannot go out, because the repelling capacity of this alveolar walls is completely destroyed. So all the time the lung is full of air and the patient is pants for releasing the air from lung. Rattling in the chest but expectoration little. Hoarseness, pulmonary edema. Pulmonary edema, this is the pulmonary edema, that is where the alveoli are full of fluid, full of fluid, inflammatory fluid, generally inflammatory fluid. This is pulmonary edema. Cough after influenza. Hypostatic congestion of lung. That is, hypostatic congestion means the congestion that occurs due to gravitational force. Congestion or the actually accumulation of venous blood in the lower side of the particular organ, that is due to gravity. This is called hypostatic congestion of lung. That is, in lung, as the elasticity is lost, so congestion is towards lower side. That is shown here or displayed here. So it is hypostatic because lower portion is the portion where the gravitational force acts. Expectoration of pure blood after cough. That is an important, very important symptom. Pure blood, pure red blood will come out with cough. That is a symptom of Ammon carb. Heart symptoms of Ammon carb. Wakes with difficulty breathing and palpitation. When afraid, palpitation is audible with cold sweat, lacrimation, inability to speak and trembling of hands. Angina pectoris. Angina pectoris is a precursor of heart attack. Generally, the patient feels suddenly squeezing, pressing, severe pain in the chest with dyspnea. Pain radiates to neck, shoulder, jaw, left hand, and the patient becomes very much anxious and he goes to faint. This is actually a very severe condition. In homeopathy, there are so many medicines for this type of anginal attack, but yet I would request my readers, if you see or if you get some patient which is getting this type of pain, always ask him to contact an cardiologist. It will be better for a cardiologist to study the case, whether the person is going to be going to have a real attack of heart attack. That expert may understand it. Yes, this person needs immediate attention so that he cannot get future in this real attack. This is generally not in our clinical acumen. This will not come whether this, because if you happens to be a cardiologist and yet practice homeopathy, then it is a good case for you. But otherwise, you must refer that particular patient to cardiologist. This angina pectoris actually, this is the picture where the patient is attacked with the anginal pain. Extremity symptoms of Ammon carb: pain parts laying on become numb, cramps in soles and calves, whitlow. This is the picture of whitlow. It is actually a viral infection of fingers with low. Tearing pain in the limbs better by heat of bed. Right foot numb. Right arm heavy and weak. Aching in bones better from change of weather. Skin symptoms. So, red or mottled erysipelas in aged. Malignant scarlatina. Erysipelas, this is a skin disease. Skin disease, and the picture is shown in the um, just the bottom. You just go through the picture so that you can feel or you can understand what does it look like. And scarlatina actually a type of eruptive fever like measles, pox, etc. That is, there are types of scarlatina that is malignant, and that malignant type of scarlatina is tackled by this Ammon carb. It's a very interesting medicine in case of this particular disease, scarlatina. But this disease generally is not, is not available in our country. But maybe there. Sleep symptoms, Ammon carb. Sleepiness during day. Wakes up as if strangled. Wakes up as if strangled. That is heavily uh, locked up, respiration. The sooner one goes to bed, the better one sleeps. That is the type of patient. If it is a patient of Ammon carb, he will report that, sir, if I go to bed early, then I will have a very good sleep. That is Ammon carb, patient of Ammon carb. Related medicines are antim tart, carbovage, glonin, lachesis, muriatic acid. With this, and the video finishes. Many thanks for listening and viewing. If you feel any difficulty, please write down in my comment section. I will certainly attend.